This computer. So, Dr. Bluming, hello. Avrum, nice to see you again.
Hello, Deborah. It's my pleasure.
So I'm back with you on the Zoom because I have more questions. Last time we talked sort of generally about estrogen and HRT and why it's important and why the WHI had so many flaws in it. Now I want to get very specific about my own body. So about a year ago, June 16th, 2023, I was diagnosed with osteoporosis. That same day, I got in a car accident and broke my hand in 3 places. So it took me a while. And I also broke my face. It was just like 2 months of recovery before I was like, okay, I got to deal with this osteoporosis diagnosis. And then I didn't know where to go. So my GP is no longer in my plan. So he recommended a bunch of people that I couldn't go to. So I'm sort of flying blind. The first person I could find an appointment with wasn't until 6 months later with a rheumatologist. I see the rheumatologist. She takes my PTH level. She tells me that my PTH is way high, that I probably have hyperparathyroidism. I have to go see an endocrinologist. It takes another 6 months to get an appointment with an endocrinologist. So here we are a year later, right? A year later, I meet with this endocrinologist. She takes my PTH. It's 79. It's not so high. Anyway, after going on vitamin D, because I talked to you, my PTH is now normal. So I was having secondary hyperparathyroidism from a lack of vitamin D. But now I still have the osteoporosis, and I have my endocrinologist saying, okay, we need to put you on Fosamax or Prolia. And I said, I talked to Avrum, and I'm not so sure I want to go on those. And she said, well, I have seen it with all my patients that they have higher bone density after they go on these things. And I said, yes, but is bone density the issue, or is it resilience? Because I've read this book. This is the old version. I think I left the new version back at my partner's house, but Estrogen Matters. And you had a whole chapter on the difference between bone density, which we know fades when a woman gets older, and bone resilience, which you can't test for because you'd have to break the bones. Help me understand what to do. I'm literally asking you, as one healthcare provider that I'm going to talk to among many, what would you do in my position? I don't know what to do. I'm a science writer. I don't know what to do.
Okay. First, as you know, your situation is not at all uncommon. In fact,
Right.
Unfortunately, it's the rule. Second, I'm not making any judgment on the hyperparathyroidism. That's outside the scope of this call.
Yeah.
And I don't want to enter an area where I don't claim to be an expert.
Right. And I will tell you that that's no longer an issue, because the vitamin D that you told me to take is now has fixed that problem. So it's no longer hyperparathyroidism.
So let's go over what you mentioned, which is, what is osteoporosis? And osteoporosis, as you pointed out, is a lack of elasticity in our bones, which happens to all of us as we get older. Elasticity is the ability of the bone to bend without breaking.
Mm-hmm.
Simone Biles is a wonderful example of
Yeah. Oh
somebody,
my God.
thank God, doesn't have osteoporosis. And she's terrific. Osteomalacia is a different condition that you don't hear about. Osteomalacia is a weak bone support, and that is due to vitamin D deficiency. And the typical appearance of somebody with osteomalacia is the bow-legged child who grows up in an impoverished area where they don't get milk and they're not exposed to sunlight, and they develop bowed legs, the kind of thing you'd see if somebody is impersonating John Wayne walking.
Rickets, right? It's called rickets, yes?
That's exactly right. Okay. And there, vitamin D is very good, and bone density is a good test for it. Many physicians confuse osteomalacia with osteoporosis. Osteoporosis, which is not weakness of the shell in which the bone is encased, but the fibers that make up the infrastructure of bone. Those aren't bone fibers, those are what are called collagen fibers,
Okay.
and they form a network like elastic bands that work together so that we can stretch, the bones stretch, but they don't snap.
Okay.
And that's been in the medical literature since it was first described back in the 1940s, but even many physicians confuse those two. When your doctor says that she helped many patients with osteoporosis, giving them Fosamax or Prolia, based on bone mineral density studies. Wait a minute. Bone mineral density, as you pointed out, is not a great test for osteoporosis, which is lack of bone elasticity. The best test, and you said this, is to put the arm in a vise and see how much pressure you have to exert before you snap the bone. And I'm not aware of any physician who's actually doing that. Uh, in in my dreams, I think, we can do that to bridges. Bridges are assessed for their ability to snap.
Mm-hmm.
Why can't we do that to bones? I don't know. I've asked engineers, I've asked physicians, I've never gotten a satisfactory answer. But if your physician is saying, well, I've given them these bisphosphonates, drugs like Fosamax or Prolia, uh, and I see improvement, and they're looking at improved bone mineral density, here's a flash. Bone mineral density does not correlate very well with risk of fracture. And any physician can be challenged on that. And if they say, yes, it does, the polite answer is, please show me.
Mm-hmm.
And they won't be able to come up with the data supporting that very simple blanket statement. What we know estrogen does is estrogen does prolong the ability of bone collagen fibers to remain flexible or elastic, and it decreases the risk of serious fracture, especially hip fracture, by up to 50%.
50%. That's a significant number.
Oh,
And
you
that's
think?
what the
Oh, yeah.
WHI showed?
The WHI showed a little less. I think they were between 27 and 32%, but they agree with that. They had no disagreement with that.
Right.
And since um, the risk of death from a hip fracture is about 21%
Right.
during the first year after the fracture. That's enormous. And as a result of that, doesn't mean the osteoporosis caused the death, but the death wasn't associated with whatever underlying condition may have been responsible for the osteoporosis. So it's a very real correlation. And that comes out to almost as many women in the United States dying within 1 year of hip fracture as die of breast cancer. It's about 40,000.
This happened to my great aunt. Yeah, she had a hip fracture and she was dead soon thereafter.
It's unfortunately not uncommon. And even if you survive, disability, which I haven't even mentioned, is significant.
Right.
So it's something to be avoided. And estrogen decreases the risk of osteoporotic hip fracture by up to 50%. And although the Women's Health Initiative was a little lower, they agreed with that. And so do many studies around the world.
Okay, so here's what I've been doing, and tell me what you think. So I
Sure.
started taking vitamin D. I lowered my PTH. That's great. So that's all in good range. I have been doing 30 minutes of weight training 3 times a week to strengthen the muscles around the bone. Is that worth it or not worth it?
First, that sounds to me very reasonable.
Yeah.
I got a lot of letters from people who wrote me saying, please don't dump on physical exercise, which I don't, I do it myself, because I said physical exercise doesn't change osteoporotic, the diagnosis of osteoporosis. But in fact, if it does reinforce your muscles so that you can stretch better, so that you don't fall as often, of
Right.
course it'll decrease the risk of serious fractures. And to that extent, I'm all for it. Never mind the cardiovascular benefits, which I also acknowledge.
Which we will discuss later. But
Okay.
so, vitamin D, and then I was taking calcium, and then I was told it's not worth taking calcium because the calcium at my age, 58, is not worth, it's not worth, I already eat foods rich in calcium. What do you say about that?
Calcium and vitamin D for a premenopausal woman can improve the shell of the bone,
Right.
and that's a good thing.
Premenopausal though, not
Yes.
postmenopausal.
Well,
Right.
for a postmenopausal woman who's taking estrogen, she's like a premenopausal woman, and it's probably not a bad idea.
Okay.
My
Interesting.
objection is saying you can use calcium and vitamin D in place of estrogen.
Right.
And if you use it in place of estrogen in a postmenopausal woman, I know of no data that shows that it's of benefit.
So let's go back for a second. You said that my body, now that I'm on HRT, and I've been on HRT for a good 2 years now, right? My body on HRT is the same as a premenopausal woman's body because it has the same amount of estrogen as somebody who's premenopausal.
That's too broad a statement. As
Okay.
you know from our interactions, I'm very careful about
Yep.
the words that I use.
Right.
But in terms of preventing osteoporotic fracture, yes, you are similar to a premenopausal woman, although a premenopausal woman has an edge. And it is possible, it is even likely that calcium and vitamin D can help if you're on estrogen as well. It's
Right.
not something I stress or something that I push, but since we treat premenopausal women that way, and it does improve the shell around this infrastructure that we're treating with estrogen, that's not bad. One other interesting point to point out, although the shell is important, that's not the whole story. And I don't recommend this, but if you are concerned about your bone mineral density and you take oral fluoride, fluoride attaches to the bone the way calcium does, and it dramatically increases your bone mineral density. The problem is it makes your bone less elastic because you now have an even thicker shell, and the risk of fracture is even greater.
Oh my
But you
goodness.
can walk into your doctor's office and say, look what I've done. And yeah, don't do that.
I'm about to, and I want to talk about DEXA scans for a second. I'm about to take a second DEXA scan. I'm talking to you before I know the results of that. So June 16th, 2023, I have a hip that, or a lower spine that is -3.2. My hip is -3 something. I mean, it's bad. It's bad. So I'm hoping that this year of taking estrogen, taking vitamin D, working on my weightlifting and all that has changed it. Who knows? It may be worse. I don't know. But I am going to get another DEXA scan. The issue for me is I'm 58. I had a hysterectomy when I was 44. Why wasn't I told back then to get a DEXA scan? Why are we telling women to get DEXA scans at 65 when all of this stuff is happening in our late 40s and early 50s?
Well, remember, Deborah, we already said that DEXA scans, which is another word for bone mineral density studies, don't correlate very well with fracture.
Right.
It is what is available, but it's like the drunk man looking under the light post for the key he dropped at night, even though he dropped the key halfway down the block. That's where the light is, so that's where he looks, but it's not going to help him find the key. Now,
So what would you
being,
tell? So then let's rewind for a second. Let's say
okay,
I were 44 and I hadn't gotten my uterus out yet. What do you tell? What do you tell a 44-year-old woman who's perimenopausal or 45, 46, in that mid 40s about to enter menopause? What would you say to them is critical in terms of bone health?
well, I think, as we pointed out, estrogen is the best medicine, assuming there are no significant contraindications. It's the best measurement for preserving bone health. As
Mhm.
we discussed, I think exercise, weightlifting, are very good in strengthening your muscles that will help protect your bones from trauma like falling,
Right.
not from car accidents. So
Yeah.
I'm not giving advice on that.
Right.
Uh, and if we're talking just about osteoporosis, you can discuss calcium and vitamin D with your physician. It's not something I have routinely recommended, but I would defer to the doctor who is taking care of you.
Right. And so now I'm going to go back to that doctor, and she's going to want to put me on Fosamax or Prolia. I, my gut is saying to me, no, why do I need that if I'm on HRT? But I am so confused. I don't know what to do. This is where I feel that women's health has, or the lack of study of women's health has left those of us at my age in menopause with so many questions and so much contradictory information out there that it feels almost impossible to make an educated choice.
It is always possible to make an educated choice, always, as long as you are aware of the limitations of the data you have. The
Mm-hmm.
thought that we have to do prospective double randomized studies in order to verify every bit of advice we give in medicine is, I think, absurd. The biggest double-blind randomized study that we have supported is the Women's Health Initiative, and look what that gave us.
Mm-hmm.
So that uh, I think that's a punt that I don't favor. What I can tell you, based on the extensive reading that I've done, and I'm always willing to be challenged, I welcome it because that's the way we all learn. The extensive reading that I've done suggests that the very best thing you could do, assuming that you're a candidate for it, is to take hormone replacement therapy to preserve your bone health. That's not confusing. To
Okay.
take an additional agent that strengthens the shell of your bone is not something that I recommend. I don't recommend it, first because there are side effects to every medicine that we give. There is a small but real risk of what are called atypical hip fractures that is seen among people who are put on bisphosphonates, these agents we're talking about, after 5 years. And a fracture of the hip below the hip joint, which is called an atypical fracture of the hip, is a fracture of the hip. And
Yeah.
if it's increased by taking these medicines, why should you go on these medicines that are open-ended, especially when you're taking the best medicine to preserve your bones' elasticity and your bones' health? I used to use those medicines when I was treating women who were going through cancer therapy. And the cancer therapy, by cutting off their estrogen, is compromising their bone health. And we use those medicines to help preserve their ability to fight fracture. Was it of benefit? I'm not sure.
Right. Right. So in essence, Fosamax, Prolia, those medications increase bone density, but not bone resilience, whereas HRT doesn't necessarily increase bone density, but does increase bone resilience. Do I have that correct?
Yes, you do. And that's what you said at the very beginning. And
Okay.
everything we've done is talk since then.
Okay, so that is probably going to be my answer to my endocrinologist, that thank you very much. I appreciate you want to put me on these bisphosphonates or Prolia. And she also said, by the way, that Prolia, once you're on it for life. Whereas bisphosphonates, you can take breaks from. Again, I would have to do more research, but it just, one of the things we were talking about before I turned on, before I hit record, is that because our health insurance system is so messed up. So for example, my general practitioner is no longer on my plan. So I'm on Fidelis, I'm on Obamacare. I'm grateful that we have Obamacare, but when I see my GP, I have to pay out of pocket. And then I'm forced to kind of find strangers because he can't recommend anyone anymore because they're not in my plan. So I have to find strangers, and I have to do my due diligence by looking at their Google, reviews to see, people like them or not. And everybody's going to write, there's always going to be some one nut job who's going to write, oh, this is the worst doctor I've ever had. So what feels to me, it feels like I can't get a grip on what I'm supposed to do because it takes so long to find a practitioner. It takes so long to figure out which practitioner. I mean, I saw a rheumatologist at first and she said, no, you should be seeing an endocrinologist. And then once, a year passes, right? So you're left with this diagnosis, osteoporosis, good luck. See ya. Have fun.
Okay, let's take 2 steps back.
Yeah.
When I was asked a long time ago, why were you interested in becoming a physician? And there were all kinds of stories, including the composition I wrote that got me into medical school. But one of the main reasons was so that I could read the scorecard, so that I could tell you, regardless of PR, regardless of reputation, who are the doctors I trust.
Mm-hmm.
That's so important. And many of us felt, all of us felt that we are on the A team. So that obviously the doctors we recommend are also on the A team. But if all of us feel that way, how do you know?
Right.
Because there are A, B, C, D. If you could find a physician whose ability, whose humility, whose insights you trust, that's a really good person to hold on to for recommendations, even if you're not seeing them regularly.
Right. So I'm holding on to my GP even though he's not in my plan because I love him. I mean, he's my family physician. He's the physician for my kids too. It's just, we have a long history with him. I'm not saying goodbye to him. Anyway,